The last thing that we're going to cover in chapter 14 has to do with ethers. One of the uses of ethers is that they can be used as anesthetics. So before we get into this, let me just remind you of what an ether is. The ether is a functional group. And so an ether is a molecule that has an oxygen that is single bonded to two carbons. And the carbons have other stuff hanging off of them. It doesn't really matter what's attached to them. But this right here is the ether functional group. So let's talk a little bit about anesthetics. Ethers, when they are used as anesthetics, they are used as a general anesthetic. A general anesthetic is a medication that causes unconsciousness. And when we're receiving general anesthetic, that's the unconsciousness is really the primary feature of the anesthesia, but general anesthetic also causes pain relief. The other type of anesthetic that you could receive is a local anesthetic. And a local anesthetic is one that causes pain relief in a localized area. So something that you would get injected, like when you go to the dentist and have dental work done. And they inject the local anesthetic in your mouth. It does not cause unconsciousness. It just gives localized pain relief in that one area. So the way that ethers are connected to anesthetics is that the very first general anesthetic used was an ether. It was an ether called diethyl ether. Diethyl ether's structure looks like this. Looks kind of like a bat. So this was the first general anesthetic. This was used, or first time reported used, back in 1846, so a long time ago. Prior to the use of diethyl ether, the methods that medical professionals used before general anesthetic was discovered, they used things like the patient drinking themselves to unconsciousness. Just basically getting wasted, or sometimes hitting them in the head and knocking them out. A lot of times patients had to be physically held down by 5 or 6 people or tied down to a bed or a chair so that they could hold relatively still and undergo whatever type of medical procedure they were receiving. So as you can imagine, when the medical profession realized that you could give somebody a substance, a chemical that would put them to sleep and allow them to stay asleep for the medical procedure, this was really groundbreaking in the history of medicine. So there were pros and cons to the use of diethyl ether as an anesthesia. Pros was that it was safe in terms of the patient. So it was safe to the patient. There aren't a lot of negative side effects to inhalation of diethyl ether. And it's easy to use. It's easy to administer. Diethyl ether is a liquid at room temperature, but it's really volatile, which means it evaporates really, really, really fast. And so all that they would have to do is have the patient inhale the vapors of the diethyl ether as it was evaporating, and that was it. And they created things like jars that had tubing that went to a mask that you could put over the patient's face. That was pretty high tech. They would put the ether in the jar and it would evaporate through the tube and into the patient's mask, which they'd put on their face. Or even just as simple as soaking a rag with diethyl ether and holding it close to the patient's face. That would work as well. And then in terms of long-term side effects of the inhalation, there really aren't any. So that's why it's considered to be safe. There were some cons to the use of diethyl ether. So lesser con, it does, when you come out of diethyl ether high or sedation, it's pretty normal for the patient to have nausea and headaches. Although this this is a con of current anesthetics as well. The nausea it's not something that we've been able to overcome. The bigger con of diethyl ether is that it is extremely flammable. Not just the liquid itself, but the vapors that come off of the diethyl ether, the thing that the patient is inhaling, it is very, very, very flammable. So it's, even if you're being very careful, a tiny little spark is enough to ignite a really big fire in an operating room, which makes it really, this particular con makes it really not an ideal anesthetic at all, just because of its extreme flammability. So currently in the medical field, we have a lot of different substances that serve as anesthetics. And when a person is given general anesthesia for a surgery or a medical procedure, they're usually given a variety. You usually get a couple different types of anesthetics, something that helps you fall asleep, something that helps you stay asleep. You just kind of get a mix depending on how long you need to be sedated and your own personal biochemistry. I want to show you just one current anesthetic that is an ether, a small ether that's really similar to diethyl ether. This molecule is called isoflurane. It is an ether molecule. So this is one of the molecules that is used currently for general anesthesia. And let's look at the structure of isoflurane. So it has the ether functional group. The carbon on the left of my drawing has 1 hydrogen and 2 fluorines. The carbon on the right has 1 hydrogen and 1 chlorine, and then another carbon which has 3 fluorines. So it's a little bit bigger than diethyl ether, but not by a lot, and it has a lot of halogens on it. This was first used in 1979, so it's been around a while, but it's relatively new. And today, in current times, it is typically used to maintain anesthesia. That is not how you spell typically. Typically used to maintain. So this would usually not be the drug that a person is given to help them fall asleep. It's administered after you've initially fallen asleep, and it's used to help you stay asleep. The only real negative of isoflurane is that it irritates our airway. It's a gas that we inhale, and it's irritating. But there are, we have the breathing tube down our throat, which also irritates our airway. So an irritated airway is really not that bad of a negative side effect.